Good afternoon, everyone. My name is Dr. Raquel Romero, and I will be the facilitator for the ECHO session today. Thank you for joining the Communicating with Confianza, a health literacy ECHO. This ECHO is brought to you by Health Confianza team in collaboration with the UT Health San Antonio Super Hub, the YMCA, South Central EHEC, and the University of Texas at Austin. For those that don't know who we are, Health Confianza is a community-wide health literacy program that aims to provide health literacy education, training, resources, and workforce development for Bejar County and the surrounding areas. Our team believes that health literacy is critical to transform and achieve health equity to all. Kindly, I would like to remind you that these sessions build upon each other. So we highly encourage attending each session to improve your learning experience. So I invite you to come to see and hear what we have been prepared for you. As a part of the ECHO sessions, we are going to have introductions from our team, didactics, and the second part of the ECHO is devoted to dynamic discussion, to real-life scenarios presented by a member of our community. So I invite you to think about cases that you can present during these sessions. And to ensure privacy, please note that no personal health information is allowed at any point of this session. What is personal health information? Well, is DOBs, date of birth, addresses, appointment dates, etc. So I invite you to think and consider present a case in our future sessions. Before we go to the team introductions, I would like to ask you, if you please enter in the chat your first name and your last name, this and your affiliation. This is for our attendance records. And please stay muted unless you are speaking, but I invite you to join us by video, particularly in the discussion part of the session. We would like to know you, we would like to see about yourself. Finally, ECHO is all teach online environment. We encourage you to participate in the conversation through this session. So with that, I would like to go for the introduction for our team. And I would like to start, let me see, with Dr. Adelita Cantu. She's going to be presenter for our didactics. Dr. Cantu, would you please introduce yourself?
Yes, thank you. Good afternoon, everyone. My name is Adelita Cantu. I'm a professor at UT San Antonio School of Nursing, and I will be talking with you today about digital health literacy. Thank you.
Thank you. Thank you so much, Dr. Cantu, in preparing this didactics for our session today. We also have a Dr. Rosenfeld, who is now the lead specialist in our session.
All right. Well, good afternoon, everyone. Good to see you. I'm Jason Rosenfeld. I'm Associate Professor, Department of Medicine at UT Health San Antonio, and I am the co-director of our Health Confianza program. Great to spend the next hour with you all.
Thank you very much, Dr. Rosenfeld. As a part of our team, we have Dr. Melanie Stone.
Everyone, welcome back to those who are rejoining us. I'm Melanie Stone. I'm an assistant professor at UT San Antonio, and I co-direct Health Confianza with Jason.
Thank you very much. And as a part of our hub team, we have Corinne Reyes.
Hi, everybody. Corinne Reyes, YWCA San Antonio, also part of the health literacy mentor group in the organizational health literacy as well. Okay.
So for today, we have a case presenter, Chandra Sutton. Would you please unmute yourself and introduce? Yeah.
Yes, my name is Chandria Sutton. I'm a communication specialist with the All for Them program at UT Health Houston and All for Them in Baird County.
Thank you. Thank you very much for presenting the case. And I take the moment to invite everyone to think about the case that can be presented in our session. So just remind you that ECHO is on learn, on teach environment, and we encourage you to participate in our session today. And from my end, that's all that I need to say. So I'm going to now share the space for Dr. Adelita Cantu for the didactics.
Thank you so much. I'm going to share my screen right now and get started on our presentation today. I'm going to be talking about health literacy in the age of our internet and social media. And so that will be our focus for today. Let me see if I can get all the wonderful faces. Okay. So our objectives for today are going to be looking at the differences between misinformation, disinformation, and certainly strategies to recognize, but more specifically, how to do that in the age of the internet and social media. How do you differentiate between credible and non-credible health information sources? Because there's so many out there. Look at trustworthiness of websites and identify common characteristics of AI. AI is huge. It's a big thing right now. So I'll just touch on that briefly in terms of how we might be critical consumers of that. So our focus in this ECHO series is health literacy and improving health literacy to enhance community members' ability to make the best decisions and care decisions for themselves, their families, and their communities. And this becomes even more critical in this age of social media, the internet, where information is everywhere all the time, and you have access to it all the time. So with that in mind, how do we think about being critical consumers of that? And more importantly, as we think about our role as healthcare providers, helping our patients, our community also be critical consumers of that. So just to level set, I always like to level set, let the students know where we have been, because generally we know where we have been. This is not new. We have seen some of the hysteria around the internet and social media in previous iterations. Then in the early 1950s, 1960s, there was a book that came out, Folk Devils and Moral Panics, talked about some things through our history where an invention or some type of iteration of adventure has said that there would be, or people have said there would be some social consequences from it, moral panic from that. Reaching as far back in ancient times as Socrates that felt that our ability to write things down, to write our thoughts, would mean that we would not have any free thought after that. If you can imagine in 1929, when the invention of the radio, doctors and science professionals felt that it would cause massive diseases, particularly around nervous diseases. As I was researching this, I didn't know in the 1950s, well, I guess the comic books were earlier than that when the comic books came out. But in the 1950s, we actually had a federal Senate subcommittee to investigate juvenile delinquency, which was in 1954, to study the effects of comic books and graphic comic books. And as you know, the comic books are still around. So again, what we're experiencing now hasn't necessarily been new. But what we do know is books like this have come out talking about the anxious generation, where they argue that there's been a great rewiring driven by smartphones, social media, reduced play, more screen time, saying that it's contributed to youth depression, anxiety, self-harm, and loneliness, and that social media has changed the ways that brains develop. So let's take all that into consideration when we think, how can we then, knowing that information is available to all of us all of the time, how can we help assist our community members, our patients, to take control, to become those critical consumers of information, particularly, of course, in our profession, the health information and what people read to take care of themselves, or they feel that they can take care of themselves by that information. So that is the challenge. So let's talk about social media. Social media has been around for a while now, and taking the face of YouTube, Facebook, TikTok, all of those different social media sites that we know of. But what's important to remember about social media is that they feed off algorithms. That's their infrastructure. And the algorithms, when you interact with the site, with the social media site, you're training that algorithm that then sends you information to confirm what you've already evidently were looking at in the first place. So you train the algorithms by interacting with the social media site, and then the social media site, because of that algorithms, will then start training you on what you see. And remember that the goal of the algorithms is the primary purpose is to increase my engagement, the keep on clicking, the clicking on that link. So, and they want to see more time spent on that particular app because it maximizes their ad revenues, the advertisements you see. So it benefits them to have you on that site more often because of their ability to sell it to different companies to sell revenue for their ads. So basically, they all want your attention, attention, attention. So that is a commodity that you have that they want to be able to access. And when I say they, I'm sorry about social media sites. So social media certainly has transformed a lot of different things. But in our context here, we're concerned about health literacy and ways to improve health literacy. It definitely has transformed health literacy into a critical digital skill. Often unprecedented access to information while accelerating the spread of misinformation, disinformation, which you've heard about before, but we'll touch on it again a bit more. So high quality, accessible, accurate content is essential for promoting informed decision making and positive health behaviors. We know that. That's why we really focused on improving health literacy. But from a public health perspective, the more people rely on social media for health information, we see more links to lower knowledge scores, higher risk of acting on inaccurate advice. And I put a link there to a study. 36.7% of information checked by professionals was found to be in conflict or not accurate information. So we know we have a significant issue when it comes to social media and the information that's given to users. So think of social media, particularly the algorithms are like that invisible DJ. They choose the next post based on what they think you will like and then feed you more of that. So what is the impact on you? It can create filter bubbles. It can create that content. It amplifies that content. Remember, the sites want your attention. So they do tend to prioritize sensationalism or controversial content because this often generates higher engagement. And then the platforms themselves, the social media sites themselves, although they want your attention, and that's a similar goal, but there's different uniqueness to each site. Like LinkedIn is more for professionals to engage with each other, whereas TikTok and Instagram are different. So those are the impacts that they have on you. And in that context, misinformation, disinformation is always a thing that we're going to be dealing with. So how do you tell fact from fake? Misinformation, again, just for review, is false or inaccurate information, just getting the facts wrong with no intent to harm. Whereas disinformation is false information, which is deliberately intended to mislead, intentionally misstating the facts to make you think one way. So why do people believe in misinformation? It's sticky. Once it becomes sticky, it's very hard to dislodge because people hear it or see it over and over and over again. Just like a lie, if you hear it over and over and over again, more people tend to believe it. They don't pause to think about it. It makes you have feeling strong emotions. And they may feel that they trust the source of where the misinformation is coming from. So here's some things that can be very sensational. Person deliberately advertising and selling an ineffective herbal cancer treatment for profit would be engaging in disinformation. Individuals who are already skeptical of the safety or efficacy of vaccines tend to believe vaccine-related misinformation. So just feeding on that, what question you may already have. Drinking bleach protects COVID-19. Kernel of truth, bleach on surfaces does clean and sanitize, but certainly you don't want to drink it. So promoting digital health and inoculating people against misinformation or disinformation by informing them of some common strategies. And that's what we're going to be talking about as we go forward, or what are some of those common strategies that we, as health professionals, community health workers, physicians, nurses, can help people inoculate themselves. Well, there's one. So we talk about inoculation, vaccines. Well, here's one way, or at least one strategy that's being piloted by the Harvard T.H. Chan School of Public Health. They have a site called Inoculating Against Misinformation by Pre-Bunking. And they have a series of video on their website, and I put some of those websites on here, that when we see them, that according to their research, it has a success rate of inoculating people to hearing misinformation or disinformation. So that's one thing we can do is inoculate ourselves against that, inoculate our communities to that. Another way, I didn't know about this until a couple of years ago. When you're on a website and you see these three dots that's usually on the upper right-hand side, you can click on those dots and you can report misinformation to the search engine. So like if that site is on Google and you report on these three dots, you click it and you can report right in what the misinformation is, and then it goes to that Google search engine or that search engine. So you push back a little bit on that misinformation or disinformation by taking a bit of control and letting people know that it is misinformation, disinformation. Here's another one, just acronym, SIFT. The overall idea is to slow down, consider what you're looking at, especially pictures, posts, that really, those claims that trigger your emotions. Because again, remember, that's what social media, the sites want to do, is trigger emotions, because you're going to click, or they're going to have more user engagement from you. So what about those things that really trigger your emotions? So the first thing, SIFT, stop. First of all, do you know the source of the information, the reputation of the source? Asking yourself those questions. Do you find yourself going down a rabbit hole to discover things? A rabbit going down more and more and more sites. Stop and remember your purpose. If you want to repost to get the information to others, you need to know that it's reliable information. And you want to stop here before you pass on something that may be the disinformation or misinformation. So before you're sharing something, stop and think. Do I really want to send this? Would it be harmful if I do send it? So that's the first thing. Just stop and think about it for a few more seconds. Investigate the source. Know what you're reading before you read it, right? Okay, so I know that I'm going to read something about vaccine hesitancy or vaccines causing autism, or so I know I'm reading that, so I know that I'm going to get some of those links or information that will create that strong emotion in me, but I'm going to stop before I share that. Knowing expertise, agenda of the source is also important. Take 60 seconds to figure out where the media is from, where that social post is coming from before reading will help you decide if it is actually worth your time. And this will help you better understand its significance and its trustworthiness. So, for instance, if there's a social media site or information and you see that it's coming from Lilly, the pharmaceuticals, well, they're going to have one way of looking at that, right? They're going to try to promote their vaccine or their medication. So keep that in mind, just what the source is. Coca-Cola, here's one from the American chemical industry that is a lobbying group for the chemical manufacturers. So it's going to have one way of looking at that. So it's going to be that slant. So keep that in mind. BP, oil and gas company. So they're going to see things in a different way than somebody who may be an environmentalist or who is really interested in sustainability, clean energy. So know the source is helpful because you can start understanding the slant of where they're coming from. The other thing that's useful is to know the credible versus unreliable websites. We're getting things, a social media post may direct you to a website. So one of the things I always look for with websites is where that company.com or .edu or .gov, because it will indicate to you where it's coming from. If it's .edu, it's from an academic center, it's educational institutes, generally reliable and created by subject matter experts. So .edu. Then a .gov will be government websites. Generally highly trustworthy, especially when you got some stats, policy, or public health data. So a .gov site. .org, it would be your nonprofits. But not necessarily all of them are going to be reliable. .org to me indicates that they are 501(c)(3), they're a nonprofit. Anyone can buy a .org domain, so it's essential to verify the organization's mission and their potential biases. So that's where you can look at that about, on their navigation bar, they usually have an about, and you can look at who is on their board of directors, what's their mission, vision, and values, because it will help you understand whether that's a credible source or not. And then .com, it's commercial. So companies that are making money, that are privately owned, and they have shareholders, and they're there to make revenue. So reliability will always vary. So keep that in mind. And then a .net. Now, these were originally made for networks, but now again available to anyone. And so, is it a reliable source? Again, you have to dig a little bit deeper into who they represent, what their mission and values are, and who their board, if there's a board of directors. So just some really quick and easy ways to kind of know where that information is coming from. You can find better coverage. You care about a claim that is being made. Is it true or false? Like in this one, you hear that the koalas are being extinct. Is that a true statement or not? So you want to find the best source of it, and you maybe want to scan multiple sources to see if there's an expert consensus that actually they are being extinct, which they are not. So where can you find health information, or particularly some type of health information that you may get on social media, and you want to verify it or at least see if it's credible? There are some sites that you can go to that would be helpful to understand, is this true or not? WebMD, many of you have probably already visited that. If you're searching a medical condition online, this is usually one of the first Google sites that comes up, WebMD. Now that is that is a .com site, but it is experts that contribute to that site. So this is a way of finding some really, really credible health information if you want to find out whether a claim is true or not. Another one comes from a .gov site, Health Finder, My Health Finder. This is a federal government site, and again, they have some really very, very credible information. And more importantly, they also have information that has implications if you're a community health worker, or physician, or nurse. What do you want to be able to explain to your patient because of that? So a really good site. And then there's some institutions like the Mayo Clinic, Cleveland Clinic. They also have these very credible websites that passes on, that you can verify health information that you might get on social media. And then trace the claims, quotes media back to its original context. And really important when you see a headline like this that just came out a couple of weeks ago, colon cancer increase in young people is very alarming. And where it was in the San Antonio report that I saw this, but in that article, they gave you a link back to the study that showed it. So here's the news article, but here's the link to the actual research that showed it. Those are the kind of things you want to look for, because it's just not making that claim without the context there. Now, I'll spend the rest of the time that we have, we're at 12:25, so I want to spend the rest of the time with AI. Everybody knows that AI is, here to stay. We're just starting to understand it, and we're starting to understand it in both positive and negative ways. One thing we do know is that AI can be used to create images. So, which one is the correct image? The left or the right? Which is the one that's not AI generated? Anybody have some thoughts? And I can't see the chat.
I see an answer left. Anyone else?
Yes, which one do you think?
It says the left.
The left. The
Mhm.
left one is the real one. The AI generated is the right one. And one of the ways you can tell is that as these frogs do in nature, their dots are asymmetrical. They're not all the same size or shape. Whereas here, they are all the same size and shape.
Oh, thank you for sharing that, because I was about to ask you what we can look at to see
Yeah.
what is the real and what is not the real one.
Let me show you this one. This one AI generated, this one is real. So they look at the hands that look abnormal here. These here. Whereas these are, in reality, what hands look like. So the misalignment here versus the alignment. It requires us to be fairly observant, right? So again, that whole idea of just stopping first, is this real? Is this not real? Is really important. Because many social media sites or many sites will use visuals to convey an information, to convey something. And now in the age of AI, we need to be able to say, is this image real or is it not? Now, that's kind of hard for me to do in my generation where I am, but I know with some of the students, my students, and in particular the ones in their early 20s, I mean, they seem to be very adept at understanding this because they're growing up in that generation. But again, another reason for us to stop and think and really understand the message they're trying to convey and the visual that they're trying to convey it with. And then lastly, I think it's important for us as healthcare providers to know that AI is creating these chat bots for health advice. So, if you've used Chat GPT before, so you use it, you ask a question, and it produces some kind of document or writing, etc. Now they're introducing their own app that you can utilize, or I should say a chat bot that's only there for health advice, right? So you're going to put in your question, and then it's going to generate some answers for you. 40 million worldwide use this for information. They're launching services to give consumers health advice, like I said. It can become too concrete. Again, it depends on how the algorithms are being used to generate the information, and are the algorithms reaching out to the experts or giving you the expert information as well. But the one thing that's important, particularly for healthcare providers, when I'm in the community and I get somebody who's really concerned about a particular pain they have or something going on in their body, and they checked on the internet or the chat bot, and this is what it said, you've got to realize that they are trained. The algorithm is trained to highlight the most serious urgent conditions first. And that's just the way the algorithms are being trained. So it's a double-edged sword when it comes to health literacy. Yes, it does make information more freely available, right? People can access it more freely, but it's also, remember, giving you the most serious urgent conditions, and it's also giving you information without a context, if you will. So tips for using these. Remember, it shouldn't replace your real healthcare provider. Now, you can continue asking questions to your healthcare provider. Don't overly trust what the chatbots are telling you. Ask them to simplify or summarize very complicated information. And use the chat box to remind you to take certain medications. Here's one way that chat bots can be very helpful. Sending you reminders about your medication. I know with my Apple Watch, it dings me when I've been sitting too long and I need to get up and move around. Very good information. But again, it's not going to replace your healthcare provider and getting that information from your healthcare provider. And also the one thing to look for in the chat bots, when they give you health advice, they should be giving you a link to where they're getting the source from or getting the information from, and then you can go to look at that as well. So again, bots can be very useful, sending you these timely alerts, tracking doses, monitoring side effects, even alerting clinicians. So here's a picture of one on the lower right-hand side of a chat box. So it's on your phone. And it's very seldom that we see somebody that does not have access to information on their phone or to be able to download an app like this. So finally, the thing I want to leave you with is to pause, to question, verify, and then lead. So as healthcare providers, as community health workers, as nurses, when we're getting information from our community about something they saw, something they want to verify, let's pause. Let's take that opportunity to help people understand it's important to pause when you get information, to question, and which is good. They're coming to you to answer their question. And let's you and I both verify this. Let's look at that site it's coming from and see if that site is credible. And then lead, telling them the information, what is credible, what is not credible, and help them be able to critically think about digital health information they may get going forward. We've flooded with information every day. Our greatest protection is not to avoid it, but it is to understand and to be able to differentiate, to be discerning to it. So it's important that we all take control, and that means pausing before sharing, checking before believing, and teaching others how to do the same. So I'll leave you with that, and I will stop sharing and see if there's anything in the chat or open it up to questions. I'm at 12:32, so we're good.
Thank you so much.
Let me open up the chat here.
Let's see. Is there any question?
Questions?
Comment?
AI still hadn't figured out human hands, right? Even more dangerous when they do, right?
Not a question, just a comment.
Sure.
I really liked the slide that talked about the nuggets of truth. So sometimes there's a piece of information that makes critical sense and actually has a factual basis to it, mixed in with myth. And it's really hard. I think it's really hard to debunk those things in some frameworks. And as a community health worker, we have to be very aware where people I feel like our brains are engaged in so much information that, we kind of just pin them all together and then you don't question. So I really like that, the nugget of truth. And then also, that reflection of are we asking questions? Are we focusing on where did this come from? Is this factual?
Yeah. I think that's such an important role for community health workers, for providers as well in this age of information everywhere. And traditionally, we hadn't thought about our role in enabling people to better understand, right? And so, that's part of it, is community health workers, physicians, nurses, taking some time to educate people about these strategies. Let's look at that information. Let's look at where it came from. And this is what you want to depart with them. I see Dr. Rosenfeld.
Yeah, Dr. Rosenfeld.
Yeah, I just wanted to also kind of share because it can be a challenge, and we, whether we're CHWs, physicians, nurses, whoever we are, and you're engaging with somebody who maybe is sharing a piece of information that you're wondering if this is real, is it not? I think this is where leaning into some of the health literacy principles that we've talked about in the past can really come into play. So to make sure that you don't just dismiss the thing that they say out hand, because then maybe the conversation ends there. And so there's a bit of acknowledging perspective, sharing some of this. Oh, yeah, I've heard that from other people before. Can you kind of tell me where you found that piece of information or otherwise? So you can do that kind of fishing. And then the other thing that I shared a few years back during the kind of height of the COVID pandemic is sometimes if you just kind of keep asking probing questions of people, their own light bulb will go off and they'll be like, oh, wait a second. Yeah, that really doesn't add up in my own head, even as I'm now saying it out loud. So, but I think the key is to not be dismissive of what you hear from people, even if you know that maybe it is not a factual statement.
No. So true, so true. I take that opportunity when people ask me, community members ask me about measles and the link to autism, because I'm still hearing that, it's still hearing that, and it gives me an opportunity to question more, where they're getting the information, but it also gives me an opportunity, if that person is willing, to understand where the history of that link is coming from, going back to actually where it started and understanding that there was also some conflict there, a conflict of interest between that physician and lawyers and that. So it gives me that opportunity to give that information, and then it's given to them. Do you still have that in that context? Is still having that information within that context? So it's that opportunity to change. I'm looking at also from you. It's also really important with AI tools like ChatGPT, Copilot, to look at the sources. Yeah, and that's important. Is always looking at the sources. Also be transparent in what we know. And Dr. Rosenfeld, you put in a interactive site where you can go, where you can play with the ways people can manipulate others via, oh gosh. That's good though. That's good, is having those sites.
Yeah, it's good to know and trying to understand more and more. As you said, Dr. Cantu, is pause, question, verify, right, and then delete. Because also Dr. Rosenfeld mentioned about the importance of listening and carefully paying attention and empathy. And I guess goes to the comment that Dr. Son is like, also be transparent in what we know and what we don't know. Many times, community health workers and healthcare providers may have a question that in that moment we don't know, but we can always investigate that. Thank you so much, Dr. Cantu, for this very interesting conversation.
And some picking off on Dr. Stone's comment there is sometimes it's very helpful to be able to find it out together. So if they come to you with a question, I don't know, but let's find out together. Yeah. And then we can discuss that so it's more in context as well.
Yeah, and personally, I really like it because that shows that we are humans. We always looking for the best source of information, right? We show interest in that. I think is very, very good that we get connected in that. And also, Dr. Stone says, also remember people's health literacy levels may play a role in how they are viewing the internet content, right? Please keep adding your comments. If you have a question, you can always raise your hand or you can unmute yourself and put in the camera. But thank you so much. That helps us to keep thinking on the importance of always search for more information. And thank you so much. So with that, I would like to see if everyone is okay. We can move to the case presentation. Chandria, we have a case to present. Thank you so much.
Yes, thank you all for allowing me to share today. So once again, my name is Chandria Sutton. I am a communication specialist with the All for Them program at UT Health Houston, as well as the All for Them program in Bexar County. And so my program offers community and school-based vaccination clinics. And so a part of my role as a communication specialist involves promoting our upcoming clinics in the community, but also on our social media channels. And so sometimes when we post the information online, we sometimes receive negative comments that include misinformation about vaccines. And some examples include, comments stating that vaccines are not safe, comments stating that vaccines can cause negative side effects. One example that I can think of is someone commenting that the HPV vaccine causes infertility. And sometimes we get comments that provide links to what we just talked about, external links to sites that are not offering credible research-backed information. And so, that might appear credible to a layperson, but are actually sources of misleading or inaccurate information. And so, how do we usually handle these situations? So, on our social media platforms, we typically try not to respond directly to these negative comments. We don't want to, add fuel to the fire. We don't want to amplify this misinformation or go back and forth too much with somebody on the internet. But what we do try to do is take note of, common themes or concerns that we get on our social media channels and be a little more proactive with doing other social media posts. So maybe doing a post that, talks about common myths and debunking those myths, and linking them to a credible site that they can get more information from, or also just any other kind of outreach or communication materials that we do and give to our families that we serve. And so we also, like I said, try to have a variety of credible, trusted sources on hand, both for our social media and for community conversations, so that we can have something reliable to point people to so they can get the information that they need for the concerns that they have. And so what went well and what goes less well with this strategy? And so sometimes we notice on our social media channels, even though we don't engage, other community members do. And we know that can be very valuable. Sometimes those peer-to-peer conversations mean a lot more than us commenting and saying something from an organizational profile. And it also, like I said, allows us to monitor those comments and to be proactive and address concerns that our families may have in other ways. And so what goes less well is, those comments remain visible on our posts sometimes without any kind of direct intervention. And that might influence somebody who is reading our comments, seeing our posts, seeing those things. And especially if they already have doubts, it's reinforcing those doubts that they may have. And so I wanted to ask you all, especially since there are a lot of clinicians, community health workers, what are some ways that you all address misinformation with your patients that we all could also use, that could be adapted for community to community conversations? And also when encountering someone who is vaccine hesitant, where do you typically direct them for credible information?
Thank you so much, Chandra, for this. This is very, very interesting case. So I would like to ask now the hot team and the audience if they have a question in regards to this case.
I'll get us started. I'll be brave and jump in there because it's a challenge, right? And I think, if um on like if you're looking at it just through the lens of social media, I think it can be challenging, but I do think you may have an opportunity. And it sounds like maybe you're already doing some of this where as you're collecting and seeing the common threads that are coming through, you can then even put a post out there or using that kind of misinformation inoculation tool that Dr. Cantu just shared. And I know she didn't go into it in detail, but I'm happy to share more. But the idea is basically you kind of say, here's the fact. This is the fallacy fallacy that maybe you kind of keep hearing from folks, whether you're not going to call anybody out on social media, um, you kind of warn them to say this is what's going to be coming, and then you sandwich it again with the fact. And so we found that to be effective in kind of community conversations. And then the other thing, like if you're in a like a group setting where you can facilitate a conversation, I think our team has found, and I've seen this as well, having my own conversations, is kind of posing it back out to the group, which kind of can be dangerous, right? Because you don't know where things are going to go. But as you mentioned, like you already had like community to community fact checking in your social media thread, and sometimes when that happens in a face-to-face environment, right? We already know people hide behind social media, feel bigger than they may be. You can then potentially have a more robust dialogue around the what of it. And as you, as a facilitator, if you're able to do it, don't bias yourself in one direction or another, but try to point people towards the facts that you know of, and then encourage people to kind of go searching for their own things. So that's some of the ways that we've tried to do it in our kind of community level settings. But I'd like to hear from others.
Well, I think, and Dr. Felsnell, I think you're so right. And one of the things in the community that I see has been helpful to me is leveraging the trust that I've built up over time because I've been in the community. But doing it on a social media site, like you're talking about, Chandra, is going to look different than that. So thinking about what Dr. Rosenfeld said and what we talked about earlier is with social media, it's not necessarily saying, oh no, this is not true, this is not true. So how do you think about that? Okay, here's something that somebody posted, and then here is where you're going to then give your facts, and then what other people might hear, and then go back to the fact, And so it's not that you're discarding that or saying this person or this post is not true. Thank you for sharing the information and going through that same process. So it's, how do you build up that trust when you're doing it virtually? But again, you're not discarding them, you're just giving the facts after that, right?
Yeah, and also as in the case was saying, and non-escalate, right? Because otherwise it's going to be escalating, and so we want to finish with that, and then trust Dr. Cantu, as you say, what is going to be the trust in communication. I see Sandra Zaragoza, you have a comment. Would you please elaborate a little bit more in the comment that you have here in the chat?
Well, I was just mentioning, Chandria, nice to meet you. I'm Sandra. I do marketing communications for Health Confianza. And I was just thinking from your position, which is my position, a lot of it is kind of anticipating questions that are out there. One of the tools that I use often is the Journalist Studio. It's a Google tool that offers lots of tools. You can look at trends. So you can actually put in HPV vaccine and see how it's trending. You can go into like queries that are made by, the population. And that's like a really good resource for storytelling for me anyway. So just kind of seeing what people are asking most often and how to get ahead of it. Yeah.
Yeah, very good idea to know what is there, right? And then to equip ourselves and see a little bit more prepared for anticipating a situation or conversation. This is very, very important. Thank you so much, Sandra, for sharing that. I also see Gonzalo Murillo. You have a comment in the chat. Gonzalo Murillo, if you could unmute yourself and maybe elaborate a little bit more in this comment. Could you say, I usually refer to the provider doctor. Mm-hmm. And perhaps when it was mentioned, right? Perhaps when we have a face-to-face, it's much easier to do this directly and say, just go to the doctor and ask those questions. And definitely is always a very good tool to refer to the doctor to get the right information. So thank you very much for putting that in the chat. But also I would like to ask you, the audience, have you been facing situations like these? And how you've been able to learn from there and resolve it? Would you please share with us? Maybe a short story, short comment that we would like that you can share when you face up this situation?
Well, I would, again, thinking about the community work that I've done throughout the years, I think the whole issue of misinformation and disinformation has always been around. I mean, even, during the Great Influenza, the 1920s, the history talks about a lot of misinformation, disinformation. So it's just amplified now because we have so many more avenues for it to get out. But what I have found in the work that I'm doing in the community is nothing beats just talking one-on-one with people and not necessarily validating the claim, but validating them and their concern and their questioning of it, and starting from there, and then getting getting a conversation going about, let's explore the facts and doing it together in collaboration. I that's the one thing I've, over and over again, I've seen that has worked. And how do you do that in an online space, which is Sandria's issue? That's a challenge. That's a challenge.
Yeah, another idea on how we can do that in online or in things that is not personal, because nothing replaces the face-to-face communication, because you can see the body language, you can hear the questions, the concerns. But when in situations like this that we are facing more and more often now, how we could resolve this? Maybe.
And if there's a way that your infrastructure could support having those conversations virtually, like every month there's a chat, I don't know, some kind of chat a virtual chat, a virtual coffee, and chatting about information so that you can at least have some sense of who's asking the question, where they're from, and what the context of their concern is.
Yeah, and around many topics, right? Like it was mentioned, HPV was mentioned. Is there a comment or question or experience that you've been facing up before in that regard? So, in any other health issue that you would like to share here? Because this is, in essence, a very good opportunity that we learn from each other, and we all face up different circumstances and different situations, even in the same topic. It can be different questions that we receive, and this is a learning opportunity. The HPV vaccine always brings a lot of questions, a lot of comments, and how we can do that. But it's other conditions, health conditions, right? Chronic conditions as well. Anyone from our audience would like to share today? Experience that you have been facing up in terms of having a question and how you deal with that, how you manage it.
I have a comment. My name's Gigi. I'm a community health worker. And I primarily deal with Medicaid patients. So a lot of parents have expressed their concerns, over the changes that they have made to the vaccine schedules, and the recommendations, as far as I mean, they're saying to still get it if you want to get it, but it's not something that is required now, where you would need like an exemption to go to school. So it's like, how do you combat that misinformation that they get from social media, in regards to vaccine hesitation already? And it's kind of like they're adding this small panic button, like, oh, we don't have to get it. It's recommended, but now we don't have to do it. So it's like creating another barrier to a already vulnerable population who, in a lot of cases, there's like gaps in their care. And now we're telling them just not not to go get it. You don't need it for school. You don't need an exemption either. And so now we're seeing all of these increase, rates of these diseases that we eradicated essentially, by the vaccine. So it's just me confidently, sharing that with them, and just going through the science of it and the fact that, I mean, we did eradicate these diseases. Nobody has smallpox. Like you haven't really, I hadn't heard of anybody who had measles in forever. So it's just kind of reinstilling that confidence that healthcare providers do know what they're doing. Like the science, it does back, everything that they have found out, and how far the just medicine has come, just in general. I mean, they didn't know that cigarettes was causing cancer, and then they did a trial study on it, and that's how we figured out that those things are extremely toxic. So it's just kind of hard when people that they trust are kind of like changing the narrative. It's like, how do you instill that confidence back with the people that you're talking to?
That is a very, very relevant topic for sure, because we do have a changing vaccine landscape um, through policy. Not necessarily that vaccines, the effectiveness of vaccines, those are still the same. The policy landscape has changed. So yeah, I've had these conversations a lot in the community. And it's again validating at least their concern and why they're concerned, and do appreciate that. The one thing that I have found successful is not necessarily trying to convince that the vaccines, the science shows that they've, brought down infectious disease, etc. But I speak about the consequences of those diseases that had been non-existent previous. So like, what are the statistics or around measles? 1 in 5 children end up in the hospital. There's vaccines, amnesia. It could wipe out your immune system. So these are some of the things that I reiterate, so that they have all the information in terms of making that decision about whether to go for the vaccines or not. Yes, many people feel, okay, kid gets measles, they're going to be fine after 5 days, after 7 days, or whatever the case may be. Well, it doesn't happen in every case. And these are the statistics that tell us what would happen to children that do have measles or diphtheria. But yeah, it's a reality in our environment right now that the political headwinds are making those decisions much more complex. But yeah, Gigi, I wish I had a better answer for you to help you. But I think it's important for us as healthcare providers to understand what are some of those consequences of the diseases, and to certainly give that information to the parents to enable them to make those best decisions for themselves and their family.
Yeah, thank you so much, Dr. Cantu, and thank you, Georgina, for this question. Just like we've been saying, go back to what is there, right? What the science says, and go back to those facts. I want to ask Dr. Rosenfeld about the summary of the recommendations, but there is also one comment here in the chat. It says, from Jesus Hernandez Alvarez, it is challenging to share information, but I think it starts by gaining their trust and asking questions to first get to know their concerns and allow them to share what they have heard. And in this way, address the root cause of the hesitancy. So very, very important. And that all begins with being good listeners instead of just overwhelming with the information, and also share with the CDC website helps as a resource. in that term. Thank you so much for sharing that comment. We always promise to read all the comments in the chat. So with that, I would like to go to Dr. Rosenfeld and get a summary of the recommendation.
Yeah, what a wonderful echo session. Again, thanks, Chandra, for the case. Thought it was wonderful. It's a challenging environment that we're living in, and so a couple things that jumped out to me about our conversation today. I loved the idea of social media as the invisible DJ, and so kind of thinking about how what we're getting in our social media feeds and even online is being tailored to our preferences. And so the more you prefer a certain thing, you're going to see more of it. We talked about the difference between misinformation, disinformation, one being intentional, disinformation, one being unintentional misinformation. And this is not new, as Adelita mentioned. This has been going on ever since, humans can communicate. And so it's just now it seems more prevalent because of social media. We talked, Adelita gave us some skills on how to address this misinformation inoculation. Just like with vaccines, you can prepare people to kind of hear or receive misinformation and disinformation and be less susceptible to I guess internalizing that. And so that's a skill that I think we can all continue to work on. We learned about the SIFT acronym, so stop, investigate, find better coverage, and trace claims. I think for me, this is one of the key pieces is that we have to learn as individuals to be more savvy consumers of information. Yes, I know we're all busy. Everyone is busy, but we do need to kind of remind ourselves that just because it came through my feed does not mean that it is a factual statement. And then we had a great discussion about the real world kind of applications of addressing mis and disinformation. And I wanted to lean into some of the key health literacy principles. Acknowledge perspective. Don't dismiss people because you disagree with them or you know that what they're saying is false. Acknowledge the perspective and then open the dialogue using active listening and being empathetic. And the final thing I'm going to say, and I didn't get a chance to say, is avoid the but. When you say, that's a wonderful thing, but the minute you put that but in, you've now negated everything you said before and get you to the same place, and it doesn't disregard what they had said previously. So that's what I've got. Thank you guys for a wonderful echo session.
Yeah, thank you. Thank you so much for the summary of the recommendations. We hope, Chandra, that all your questions were answered. We all have the opportunity to share and learn with these sessions, and I invite you to come our next session in 2 weeks. Thank you, Dr. Cantu, for this wonderful didactics, Dr. Rosenthal, as always, Dr. Stone, and everyone that participated, Georgina, Hernandez, Sandra. Thank you so much for being part of these learning sessions. And so for all those that attend the session, please check in the chat. You're going to have the opportunity to have some educational credits, and you're going to have some time to complete that. But your feedback is so important for us. Those sessions are made for you all. So thank you so much for this opportunity, and I hope to see you next time. Come and see us, okay?